Healthcare reform is critical to the future of our economy. We cannot afford not to fix it. CAUSE is testifying in support of the SustiNet bill. Many of the bills that you've heard today address pieces of the healthcare puzzle. The SustiNet plan detailed in this bill is the most comprehensive Connecticut-specific plan for universal health care ever presented to the legislature. SustiNet is the product of the best thinking of experts and the combined ideas of many stakeholders. We applaud the Universal Healthcare Foundation of Connecticut for its leadership, tenacity, and vision in producing this plan. Connecticut must not shrink from this challenge and this great opportunity.
As a small businessman, when it comes to health care, I can't wait anymore. The problems around the lack of health care is one of the first things small business owners bring up when you ask them about the staying power of their business. In my case, in the 4 previous years, I've had the business and the ability to double the size of my staff in my business from 8 to 16. That means I'd be employing 16 state residents, not the 8 great staff I have presently. The single thing that stopped that growth was my inability to attract qualified employees because I don't provide health care.
Do you consider the small group or individual health market healthy and viable right now, the health insurance market for you?
Well, I have my own business, and I believe that health insurance is something, as a business owner, I should be able to provide for employees, and it has caused me to not grow my business because I simply can't afford to do everything. So I don't grow that business.
One of the things that I've noticed is that I have a young man inside the church, and one day I caught him using an asthma pump. And I said, "Oh, I didn't know you had asthma. I never seen you use an asthma pump before." And he said to me, "Well, Pastor, to be honest with you, I can't afford the medication, nor can I really afford to go to the doctor, and I don't have the proper insurance that I may be able to go." And he was using someone else's pump because he couldn't breathe. Now, I'm 280 pounds, and walking up the stairs sometime for me is sometimes tough, and I could imagine what it is for a 22-year-old man, young, very well in shape, but still not being able to breathe on a regular basis. I don't know about you, but that seems scary to me. I have a young lady who is in school and is working 2 jobs, but still cannot afford health care, and yet she's afraid to go to the emergency room because of the cost that it's going to cost her, but yet she has blood coming out of her bowels, but she's more concerned about the price that it's going to cost her to go to the hospital than really worried about her health care. I don't have a whole lot to say on all the policies, but I do have to say that if we look at it on a broad scope, something is wrong somewhere. Something is broke somewhere. And we as a people have to come together and fix it. And I'm looking at a great state. So therefore, I know that our leaders inside this state are great. And I know that your minds are great. And I know that we can come together, and everything that I've heard about this has been great. So I'm going to ask you, at the sign of that bell, to really think very positively on passing this bill so that we can not just help everybody, but help our future with these young people.
Finding out about SustiNet and what it will do for Connecticut residents has given me a glimmer of hope, but I depend on you, our legislators, to make the right decision. Right now, there's a very skewed healthcare system. It is tiered, and that is not fair to anyone. There is no reason in a state that consistently ranks in the top 3 wealthiest in this country that we should have residents who do not know how or where they will be able to obtain the health care that they will need. In my mind, access to quality, affordable health care should be a right, not a privilege. We should all be able to obtain the health care necessary to maintain our health. Keeping Connecticut residents healthy is far cheaper than letting them get sick, especially when we cannot or do not feel able to obtain services until we wind up in the emergency room. I hope that you, my legislators, will see the importance of this legislation to all the residents of this fine state. I pray that you will follow your conscience in this and remember that we are all entitled to quality, affordable health care. Please give us that peace of mind. Thank you for your time.